Hello, everyone. Hope you're all having a great day so far. Welcome to episode 17. Today is Wednesday, December 30th, 2020. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Hope you're all getting geared up for New Year's Eve tomorrow. I know many of us are physically distancing, but there's always sparkling wine and sparkling cider to ring in the new year. Bye-bye, 2020. Good riddance. Now, do you need compliance tips for your sleep studies? Well, look no more. I get into it in this episode. This episode highlights the month's criminal and civil enforcement cases and my trusty compliance tips on polysomnography, sleep studies. And I also share some fitting words from Stephen Hawking. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss an episode. Please write in a review and rating on Apple Podcast or wherever you listen to my podcast. I'd really love your support. Now, a quick disclaimer. Before I get started on the episode, this podcast episode and Nexsen Pruet podcast series do not constitute legal advice, but I am fortunate to work with sound healthcare attorneys at Nexsen Pruet. And as their consultant, I have over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. Again, the opinions and insights throughout are mine alone, and they in no means constitute legal advice. So, let's get into Newsworthy. The month of December saw 23 cases of fraud, waste, and abuse as of the recording of this episode. Early December saw a major bank extortion scheme, pill mill or illegal prescription distributions of Schedule II opioids, thousands of fraudulent claims for services never provided to another vulnerable population that we have, children. There were also kickback schemes and False Claims Act allegations by the handsful throughout the nation. There was alleged upcoding of DME braces and another case involving, in my opinion, the medical device company's blatant disregard of medical coding critical thinking and correct coding application. But I'd like to highlight two cases that I find most interesting. First, there was a case involving a sleep lab that has paid the United States $154,824 to be exact, to resolve claims that it improperly billed the Medicare program for sleep studies. A review of their claims data demonstrated that the sleep lab was one of the area's highest paid sleep labs. Also, the investigation revealed that there had been several complaints regarding the sleep lab's failure to adhere to Medicare regulations. Medicare rules and regulations require that properly trained and certified sleep technicians administer sleep studies. However, from January 1st, 2015 through July 15th, 2019, the sleep lab improperly billed and received payment for sleep studies when they did not have the properly trained and certified personnel present. The sleep lab also allegedly violated the False Claims Act by knowingly submitting or causing to be submitted false claims to Medicare for payment for sleep studies performed by these non-certified technicians. Now, the second case involves an executive who has been ordered to serve 20 years in prison and pay $120 million in restitution after his conviction related to allegedly falsely telling thousands of patients with long-term incurable diseases such as Alzheimer's and dementia that they had less than 6 months to live and subsequently enrolled them in hospice programs. Wow, that's crazy. The alleged scheme included paying kickbacks to physicians and fraudulently enrolling these vulnerable patients in hospice care that prevented them from accessing curative care. And this was all done to steal millions of dollars from Medicare to fund lavish personal spending, according to a special agent in charge with the OIG on the case. There was an alleged strategy to market the hospice programs as providing medical benefits, quote, "You don't have to die to use it," end quote. There was allegedly aggressive patient enrollment for those with long-term incurable diseases like Alzheimer's and dementia, and limited mental capacity patients who lived at group homes, group nursing homes, and in housing projects. In some instances, marketers allegedly told patients that they had less than 6 months to live and sent chaplains to lie to the patients. There was even alleged discussions of last rites and preparations for these patients' imminent deaths. Hospice services require patients to be suffering from a terminal illness expected to result in death within 6 months. Not only were the patients not in these circumstances, they were walking, driving, working, and even coaching athletic sporting events in some instances, allegedly. However, patients were allegedly on services for multiple years in order to increase revenue. Justice was allegedly obstructed by causing the creation of false and fictitious medical records. The executive produced these false and fictitious records and produced them to the federal grand jury in order to attempt to avoid his indictment. The records allegedly added false diagnostic information, making it appear that patients were dying when in fact they were not. Now, the Muntz cases showcase the facts that understanding CMS policies and guidelines, LCDs and NCDs, are integral to demonstrating your practice's overall dedication to and ongoing maintenance of compliance. For sleep studies, you must know that personnel should be credentialed and qualified to perform the services. For DME, just like I discussed in episode 7, you must document according to the medical necessity of the device. The braces involved in this month's case were allegedly custom fabricated and not based on medical necessity and meeting coverage indications. So I always believe these types of fraud, waste, and abuse cases are most helpful. Take a deeper look into these reports and see how they may affect you, your provider, your facility. Start self-auditing your service claims and coordinating documentation to ensure you are meeting compliance. And now, it's time for my best practice tip in Trusty Tip. So let's start with some background on the seriousness of very, very, very lacking compliance in the world of sleep studies. Now, in a study done by the OIG and published in June of 2019, it was found that from January 1st, 2014 through December 31st of 2015, MACs nationwide paid freestanding facilities affiliated with hospitals, and physicians approximately $800 million for selected polysomnography, which is again a type of sleep study, to diagnose and evaluate sleep disorders. Now, some of the reasons for denials. Previous OIG reviews for polysomnography services, sleep studies, found that Medicare paid for services that did not meet Medicare requirements. These reviews identified payments for services with inappropriate diagnosis codes, without the required supporting documentation, and to providers that exhibited patterns of questionable billing. Through their audit, the OIG estimated that Medicare made overpayments of $269 million for polysomnography services during the audit period. These errors occurred because the CMS oversight of polysomnography services was insufficient to ensure that providers complied with Medicare requirements and to prevent payment of claims that didn't meet those requirements. Now, let's get into some documentation requirements required by Medicare. CMS requires an order from the provider who treats the beneficiary for all diagnostic tests, including polysomnography. Polysomnography providers must enter the name and the National Provider Identifier Number, the NPI, of this ordering provider on the polysomnography claim. Polysomnography is covered only if the beneficiary has the symptoms or complaints of narcolepsy, sleep apnea, impotence, or parasomnia, which must be documented in the medical record. Polysomnography for chronic insomnia is not covered. Now let's go over how we can prevent denials. Medicare will cover polysomnography when the following criteria is met. So to maintain compliance, let's follow these steps. The clinic is either affiliated with a hospital or is under the direction and control of physicians. Medicare may cover diagnostic testing routinely performed in sleep disorder clinics, even in the absence of direct supervision by a physician. Beneficiaries are referred to the sleep disorder clinic by their attending physicians, and the clinic maintains a record of the attending physician's orders. Medical evidence confirms the need for diagnostic testing, which means the physician examinations and laboratory tests need to be there. Diagnostic testing that is duplicative of previous testing done by the attending physician to the extent the results are still pertinent is not covered because it isn't reasonable and necessary under Section 862A, 1A of the Act. Now, the OIG says that CMS will continue to work with the MACs to educate providers on properly billing for polysomnography services, including the requirements outlined in the Medicare Program Integrity Manual, Chapter 5, Items and Services Having Special DME Review Considerations. And don't forget, earlier in the Fraud, Waste, and Abuse Newsworthy section, I also talked about sleep studies that require technicians to be certified. They have to be educated and receive a certification to qualify and perform that particular service. So remember that as well. So it's critical to understand, again, the many, many, many nuances that are required in compliant sleep study documentation capture and the documentation retention if you're ever involved in a post-payment audit. Remember, by painting a true and honest medical picture each and every time that supports the medical necessity of the services that you perform each and every sleep study, your certified medical coder can then abstract codes with accuracy. And finally, in this week's inspiring quote in Spark is from the late great genius, Stephen Hawking. Intelligence is the ability to adapt to change. Powerful, right? That's all of us right now. Are we using our smarts? Are we using our savvy in the name of change? I think we are, here in this space of healthcare. I'm always marveled by all we have done, how far we have gone in just these recent months of the COVID-19 pandemic. I know we will forge ahead even further in the new year to come. I am happy Stephen Hawking's spark still burns brightly in all of us today. So that wraps up today's episode. Wishing you all a very happy and healthy 2021. I appreciate you diving into today with me. And if you would like to inquire about my consultant services, You can always reach me through my email address at nexsenpruet.com. I'll leave links to everything in the show notes below. Please continue staying safe and healthy. Practice safety for one and all during our collective life in the time of coronavirus. Thank you for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday. If you want more information from me, go ahead and follow me on LinkedIn or send me an email at sonalpatel@nexsenpruet.com for all my consulting services in medical coding, auditing, and compliance. Thank you.